According to the World Health Organization, 3/4 of the world's patients who are co-infected, meaning suffering from both TB and HIV and AIDS, live on the African continent. TB alone kills more people annually than HIV and AIDS, and in combination, the two diseases are lethal. South Africa's Health Minister, Dr. Aaron Motsoaledi, is the chairperson of the United Nations International Board of Stop TB Partnership. He has been at the forefront of the fight against these epidemics.
TB has now overtaken HIV 2 years ago as the biggest killer of all infectious diseases. Unfortunately, people don't know that. They don't know it. The second thing I want to tell you is that over the past 200 years, TB has killed more people than HIV and AIDS, than malaria, than Ebola, than bubonic plague, than polio, than influenza. All of them added together. TB has killed more people than those. If you are HIV positive, your chances of getting TB increases by 300%. If you are diabetic, your chance of getting TB increases by 500%. If you have got silicosis from silica dust, which is largely obtained from gold mines, your chance of getting TB increased by 600%. If you are HIV positive, but you also have silicosis, your chance of getting TB increases by 1,800%.
The World Health Organization asserts that the risk of developing TB is estimated to be 26 times to 31 times greater in people living with HIV than those who are not living with the disease. In 2014, for instance, there were new TB cases that were 9.6 million. Out of those people, 1.2 were living with the HIV infection. Dr. Motsoaledi says although TB is the leading cause of death in the country, in the past decade, South Africa has dramatically improved its TB treatment strategies.
The number of people who were dying from both diseases was absolutely out of this world. By 2009 in this country, 70,000 people were dying of TB annually.
Now, more than 70% of those who develop the disease are successfully cured.
The figure has gone down to about 40,000, as I've told you. For HIV and AIDS, the number of deaths were about 350,000 annually. The figure has come down to about 180,000. So you can see that is progress. If I take you back to 2004, 70,000 children used to be born HIV positive every year. But because of our success of PMTCT, prevention of mother-to-child transmission, that figure has come down to less than 6,000, from 70,000 to 6,000. That we regard as huge success.
South Africa still has much more to do to win the battle against TB and HIV and AIDS. Yolisa, Njamela, CCTV, Pretoria, South Africa.